patient is being treated for a low back strain that occurred 5 days ago and is experiencing paraspinal muscle spasm. Is unable to forward flex without the trunk without pain and is having difficulty transitioning from standing to sitting supine. Please demonstrate your ability to apply moist heat pack to the patient. Begin by getting informed consent and explain your steps as you perform the skill. Follow-up questions will be asked if needed.
Okay. Okay, so you have been, you have a strain of your lower back that's not allowing you to flex forward, and you're having trouble sitting up and standing. My recommended treatment for this would be using a moist heat pack. This would allow the heat to concentrate in that one area, as well as put you in the most comfortable position. If this is done, it would increase your range of motion and decrease the muscle spasms in that area. Another option would be heat immersion, so putting you in a heat bath. However, you do have a problem with transitioning from sitting to standing, so I don't really think that would be beneficial for you, as well as there's more risks of you being in there for too long and not being able to concentrate the heat in one area. And if we don't do anything, well, you're just going to be kind of in a state of pain. Your muscles are, your area is in the phase of healing, the proliferation phase of healing. So we're going to use heat just because it's past that acute inflammation phase. So if you would want to do the heat pack, I think that would be most beneficial for you. Okay, so I'm going to have you lie on your stomach, it's on your back. Yeah. In a most comfortable position for you. And then I'm going to just move this up. And I'm going to be looking for any like contractions. So if there's like open lesions or anything on her back, that'd be a sign that we can't use a moist heat pack. But there's nothing. So I'm going to go move in to get the heat pack. So I'm going to take you're going to want a layer of 4 to 6 towels between the skin and the person's the heat pack. This is about 4 layers, and then I'm going to assess her comfort level after that.
Right next to you.
Yeah, wow. Close it up. And then again, this is a layer like about 4 towels. So this is a good enough layer for this, and I can place it on her lower back, and I'm gonna leave it there for about 15 minutes, checking out about every 5 minutes, making sure her comfort level is good. And if it's too uncomfortable for her, if the heat's too intense, like right now, we can put more layers of towels under. But this treatment, it's going to get gradually hotter as the heat's going to have to transfer through the layers of the towel before it hits your skin. So again, if it gets too uncomfortable for you, tell me, but just realize it's going to be a gradual heating up of that area. It'll be like about 15 minutes of this. 10, 15.
And then say you walked away for 5 minutes and came back. What are you going to ask your patient?
I'm going to ask her how she's feeling, if it's too hot, if she's kind of feeling very uncomfortable in that area, if she's not feeling herself.
All right, 15 minutes has elapsed.
Okay, so I'm going to remove the heat pack, and then I'm going to assess the area for any skin damage, such as burns, blisters, very tender to the touch, anything bad. That would be a contraindication that this didn't work. And then I'm going to bring this over here.